monthly reports, and they use it to provide testimony to the city council. And they will do, on an annual basis, they do an in-depth analysis of the notices and what they found, and they will, they're tracking and reviewing all notices doing a 2 to 3 month period. So they've been doing that on an annual basis. And then they generate a report based on the trends that they're seeing and these notice deficiencies. And their report was quite lengthy. I did not do a screenshot of every page, but I did, if you want to go to the next. Well, I was jumping ahead, wasn't I? There you go. I did pull the charts that were in their report just so that you could see the stats and the measures that they were looking at. And so if you look at the top chart, you'll see their complaint venue. They have the district versus the national numbers for, I believe, and I would, Mark, you can correct me if I'm wrong, is this both? Thought I knew what that one was, but now I'm questioning myself. Mark, can you jump in and share what that
is? It's on. I actually didn't realize we had actually sent you these, but the top chart that everybody's looking at is just simply for FY 2017 where complaints came from, and as you can see, yeah, most of them came from nursing homes, but a significant portion of our complaints that also deal with discharge issues, quite honestly, are coming from home and community-based service clients who are being terminated from their waiver services.
Okay, thank you, Mark. Throwing me a lifeline there.
Yeah, sure.
And then you'll see below it's nursing home complaints by category, and then the CRF and the is that your assisted living and your care facilities?
Correct.
Okay, the complaints by category on the bottom right hand. So those were some of the information that were pulled, among other. Obviously, his report isn't just about the discharge process, but you'll see their most frequent nursing home complaints, which is not a surprise, discharge eviction, and then the same for the other types of homes. The most frequent complaint is the discharge and eviction. So this is the annual review of notices of discharge, transfer, and relocation. This is just the beginning page of that really long report that I was referencing. Okay. Mississippi tracking. Mississippi so far has been the only state that I could find that has developed an emergency transfer form for facilities to use in order to comply with the notification requirements. And they're also developed a tracking system to help them identify their own trends and types of discharges and facilities that initiate those, just to help them track at the state level. Okay. This is their emergency transfer log that they have sent to the facilities to use. And you can see at the bottom that they're indicating that this is the state-approved transfer log that must be used and a date that it's due. Yep, that's okay. You can go to the next. The Nevada tracking notice also uses an Excel spreadsheet, and I think it's the next slide. And that shows you what they are tracking in their office when the notices come in. And I believe that Jennifer is charged with this wonderful task at this point in time. Okay. In Ohio, they are also tracking data in terms of when the notification comes in, reason for discharge, proposed location, and they are looking and they're reviewing the data quarterly, and it's organized also throughout, but it's reviewed on a quarterly basis. So Tessa gathers the information, and you'll see in the next the next slide has these lovely charts that they are put in so that this information is sent to the state ombudsman and others so that they can see on a quarterly basis where they're at with specific data points in with the notices of transfer and discharge. So you can see here that this is for July through September 2018. Their most common reason for proposed discharge is non-payment. And if you look down onto the chart with the percentages and the numbers, for your clarification, what they're calling AGI is what we all might call a consultation. So it's kind of their own lingo, but just to clarify, that's what that particular stat is. So what they're doing is they're looking at the number of notices that they're receiving, how many of those are turned into a consultation, and how many of those turned into a case, and then what was their follow-up, the follow-up for the state office request. So they break that down even more by region, you'll see on the left-hand side. Also, if you look at the right-hand side, this is the proposed locations. So they're tracking that, which I think is an excellent idea, particularly to use if you are trying to work on legislation and what have you. I know a lot of states have problems with the hospital dumping and facilities discharging to very inappropriate places. So they're actually tracking those numbers so that they can have real solid numbers when they're needing to testify or to go to the legislators to talk about the problems that we're having with inappropriate discharges. Okay. Pennsylvania is also using their data collection system to review and log their notices. And they are reviewing and logging both the facility initiated as well as the hospital transfer list. So on the left is they're getting notices for voluntary discharges as well, but they, so the left-hand one says voluntary discharge and hospital transfers, and you see the numbers there, and then on the right are the involuntary discharges. That would be the 30-day notices. Okay. And then this just shows you what their discharge transfer logs look like for both voluntary and involuntary. And then on the right, you see that they have a facility database. So they're able to track what facilities are sending the notices and which facilities are not sending notices. Okay. Questions?
Thanks, Jamie. Did any of you have questions about what Jamie reviewed for additional clarification about what your colleagues are doing? Or did you, if we shared information from your state, was there anything that you wanted to elaborate on or add to or clarify? And you should be able to unmute yourself, but if not, you can raise your hand and I can unmute you as well.
So this is Lori. I mean, I find the forms and the data collection really interesting and useful, and can only kind of guess how seeing that data has impacted the advocacy being done. So I would be curious from the states that are collecting the specific data and how you're using it in your advocacy, and is it making a difference in what you're seeing around the way you work with the long-term care facilities or with the licensing agencies?
Thanks, Lori. That was actually one of the questions on my list, was asking about kind of the outcomes of tracking that information as well as sharing it outside of your organization. or your program? So good question. Anyone?
This is Mark in DC. It's obviously, for us, it's changed our work with the licensing and cert agency a little bit, in that we're providing them this information when we see trends for them to follow up on. And there have been a couple facilities that have been cited because they failed to, provide appropriate notices to residents. So I think they're appreciative of it. It's interesting because I don't think, obviously these notices have to go to our Department of Health. I don't know that they're tracking any of them. So if there was an invalid notice, I'm not sure they would even notice.
Yeah, that's a good point, Mark. I was wondering the same thing whenever you shared during one of our calls that they're required to send them to survey and cert as well. If there was
So we're seeing that, and we're trying to do some sort of response or analysis, but it's technically it's the survey agency that should be looking at these things and probably spotting some of these trends themselves. But quite frankly, I don't think they do. So without us, they wouldn't necessarily, at this point, they wouldn't know if a facility isn't sending reports or is sending invalid, notices. They just wouldn't know.
Well, and having these numbers, Mark, these actual statistics that we're pulling, I think gives us more credibility than saying, oh, this is happening a lot, or we're noticing an increase. Well, what's the increase? You can refer back to your tracking and your statistics on it.
Yeah, it gives us something to stand on, and it's how we discovered, when we kind of do the more in-depth stuff, that there were a couple of facilities that we named in our report and that we shared with everyone that had no notices. And you have a facility of 150, 200 people, and you're going to tell me that no one was discharged over a 2.5, 3 month period? Not likely. And it was simply because they weren't providing any notices to us.
This is Tessa, and to piggyback off of that, right now that's really what we're looking at too, now that we're, about, I'm really bad at math, like maybe 2.5 years in, approaching 2.5 years. Now we're looking at kind of what Mark's saying with who hasn't sent them to us now. And then also kind of looking at, okay, are some of these homes owned by the same company, or is it just kind of individual sporadic homes? I just want to add that.
Tessa, that's a good point. Some of the things, when you're tracking who's sending the reports in, you can make a determination if it is sporadic, or if you have a number of facilities within a particular corporation. And so you could then address the problem with the corporation itself as opposed to each individual facility. So, and it's important to talk to them about what their policies are. And so I think that that's a really good thing to make a point of.
Right. And, and I think from what I remember, we had a little bit of both, but the thing that was pretty shocking was we found about 1/3 of our nursing homes weren't sending anything at all.
This is Mark. If I could just mention one other thing, that I think is useful as we review these, keeping track of the reason for the discharge that they put down. And what we found in one particular facility, we had a series of notices that came in over about a 2-week period, and we noticed that they were all for failure to comply with the smoking policy, which led us back to the facility to say, well, what's going on? And so they had instituted a new smoking policy. They're attempting to go smoke-free. But they failed to sit down and kind of like care plan or talk with those residents who are smokers so that they understood exactly what the policy was and how they were supposed to go about safely smoking and all that. So anytime they would catch somebody with cigarettes or smoking paraphernalia on their person, no matter where they were, they would immediately issue a discharge notice saying they were unsafe to themselves and others. But there was never any, what we found was when we asked, it's like they never sat down with these folks to make sure they understood what the policy was. So by using those discharge notices, we were able to identify that particular problem and go back to the facility and say, you can't do that. You need to back this up and start over.
Thanks, Mark. So what I heard both of you share was that in some cases, the state survey agency did cite in examples that you shared with them, or at least they started looking more into those. So are they citing because, I'm assuming it's because it was an inappropriate discharge, they didn't follow the policies, etc. Or have you seen any citations for, not actually sending you the copies of the notices? So, Tessa, those 100 or so facilities that have never sent a notice, like what is happening there? Is any collaboration going on between the program and the state survey agency?
Yeah, so we're drafting up a letter. We want to send up another letter to the providers, and then I think what the plan was is like maybe in another 6 months or something, review the list and then talk about, referring them to the regulatory authority. I think we really wanted to give them maybe an opportunity to, correct it, because we're seeing just frequent changes of administrators, building sales. So we just kind of wanted to make sure we reached out before doing that. Now I know sometimes we'll see homes, what I'll do is if there's a pattern of them sending it to us, unreasonably late, then we'll refer that, and we are seeing citations resulting in referrals for homes that are waiting till, and I don't know what other states have, but in Ohio, we have the full 30 days request a hearing, but there's a little extra protection that's added within the first 10 days if you request in that time frame. So we're seeing homes that might send it on day 11 or 12, so we'll refer and then we'll see citations result as a result of lack of prompt notice to our office.
Thanks.
Hi, this is Becky in Pennsylvania. Jay and I were just talking about the notices that each of you have sent out to your facilities with the requirements. Were those notices worked at all in conjunction with your licensing agencies, or have your licensing agencies seen those notices and I guess, not to say bless it, but they agree with what language is in there? And then do you know if they follow that when they're going out and doing their surveys? The reason I ask is because we have that flow chart that we have used, that you had demonstrated, and that was provided from our Department of Health to the facilities. And then we also provided that to our Ombudsman. However, the facilities, the stuff that they still send in either doesn't match, or the guidance that they're getting from their Department of Health local field offices disagrees with the flow chart, so to speak. So we're coming up, we have a lot of inconsistencies, issues that we're trying to deal with, and sending out a letter is a great idea. We just don't know if that will still jive with our Department of Health.
And Jay here, I can take this a step further. Yesterday, I received a call from a nursing home administrator. And as you know, we've been telling them if they have any questions past the flow chart to contact their field office. I asked this gentleman if he called the field office. He said yes, he did. They referred him to the ombudsman. So that's what we're dealing with here.
Thanks, Jay, and thanks, Becky. That's kind of, this is Amity again, that's kind of what I was hitting at with whether they had cited for not sending the notices at all, is kind of where the state survey agency is with follow-up. Because I think, and certainly speak up states if I'm not right, but based on discussions with you all, I believe that most of these letters were, worked at least run by the state survey agency or shared with, and not necessarily, like you said, to get their blessing, but just to make sure everyone's on the same page. But my question is about, so what happens once you're on the same page and you've educated everybody? Where's the enforcement? And if that's not happening, then where's the advocacy about the enforcement and any kind of coordination and successes or challenges? So
yeah, I think what we've seen, the reason why we get so many different additional discharge notices other than the requirements is because the field office staff are, when they're doing their surveys, are citing them for not sending like the voluntary notices or sending the individual reports versus a monthly report. So I think that they're giving an inconsistent message. So now we're just getting, that's why we're just getting everything. So I'm just wondering if other states are experiencing that with their health surveyors, or is this unique to Pennsylvania's folks, like as far as training goes for their surveyors to understand their role?
So while everyone's mulling over that question, I don't think it's unique, unfortunately, the lack of consistency, because at the federal level, I know that we're seeing lack of consistency in how CMS is even, the regional offices of CMS are handling the cases that are transferred to the region by the states. So consistency is definitely still in within states and across states. So,
okay.
Anyone
Thank
want to
you.
share? Mm-hmm.
So this is Louise. I had a slightly different question, if that's all right. I'm just wondering if any of you if you've noticed certain nursing homes like that are part of a chain and they have not been, either they've not been sending notices or they have a history of sending inadequate notices, if you've thought about or have met with their corporate leadership.
This is Pennsylvania. We haven't seen that any of the larger chains have not sent us the notices, but we have noticed that they're the ones that are sending us everything.
And are you finding problems with like the involuntary notices, in terms of missing a location or, what have you?
I'll leave that to Jay.
What we're finding on this is not so much a lack of discharge venue, but instances of non-payment. Well, no, I was going to say instances of facilities looking at a simple hospital transfer and thinking that's a 30-day involuntary discharge for needs cannot be met. We get 100 of those every month.
And that's where they plan to have the resident return?
Exactly. They plan to have the resident return, and they send it as an involuntary discharge.
Okay, so it sounds like even if you did some training with the association, ideally, maybe joint training with survey, it sounds like you've identified a lot of inconsistencies with the survey agency, and it sounds like maybe some further work there would be helpful, huh? So yeah, sounds like there's a lot of confusion. Yeah.
I think if we had Department of Health hand in hand with us doing this, it would cut our discharge notices in half, at least.
Louise, and this is Jamie. You know, we're seeing confusion at a lot of different levels. It's certainly, I think, a layered problem in terms of the definition of facility initiated and resident initiated, the timing of the notices, where they're supposed to go. It seems as though, you know, and what I've been hearing is I feel like ombudsmen have an understanding of it. Facilities are still confused. It sounds like the surveyors are still confused, and you know, they are getting mixed messages between CMS and their survey agencies. So there's confusion and misunderstanding on so many levels, which is what we're seeing, you know, throughout this project. And some states are much farther along and ahead of the game, and some states are quite behind with nothing to do with the ombudsman or what, you know, they're able to do. So some of the issues are outside of our realm. Some certainly are within our realm that we can do, but it's quite a layered and complicated issue right now, and it's all brand new for everyone still. Feels very brand new. So hopefully we'll be able to work out some of the kinks with this project. I don't think all of the kinks will get worked out, but I think we can work out some.
Mm-hmm.
Well, so this is Lori again. And so I think some of this conversation leads into what we hear a lot about the challenges with getting the survey agency to be as engaged on this issue as we would like them to be, or even better communication around this issue. And, you know, as you're saying, Jamie, understanding about what the requirements are. And so certainly, I mean, there has been quite a bit of information that's come out from CMS on this, and certainly I think that we do need more, but I wonder whether any of you have regular meetings with the survey agency where you talk about some of these policy issues, and maybe even, you know, yourselves try to come to consensus or agreement on how to proceed around kind of the messaging that's sent back out to the facilities around this issue. So that's, I guess, one question. And then the other question, which is the next step, is have you all participated in calls with your regional offices and your survey agencies where some of this can be worked out? I know some of you do have ongoing calls with your regional offices to talk about a variety of issues where others of you don't, but has this been a forum that you've been able to use to talk about some of the challenges?
I can say in Pennsylvania, we have been reaching out to our Department of Health on these issues, and we're still in process of trying to make a consistent connection with them.
Lori, this is Mark. We attempt to have quarterly meetings with our Department of Health, and you know, we certainly share kind of the reports that we've put together, and you know, when we identify problems, we kind of handle it case by case. But we haven't had any conversation at all with the regional CMS office. Uh-huh. So I'm not sure where they're at on this for our region, at least.
Uh-huh. So I mean, one of the things that might, you know, certainly be helpful is, as we at Consumer Voice, and Louise is on some of these calls with CMS that we have on an ongoing basis with central office. I mean, we talk a lot about the transfer discharge. And so, you know, I think that's how some of these issues have risen to their attention, which caused them to send out guidance last winter at the end of last year to direct that the regional offices pay more attention to the deficiencies in this area. And so, as Amity had mentioned before, it's very inconsistent in terms of how they are responding to this, but it might be really beneficial to, to maybe do some pushing with the regional offices in terms of, either asking for time to talk about it or trying to get their attention by having a conversation with the licensing agencies. I mean, maybe even regionally, several of you might be able to do that and ask for time to talk about it and kind of, work through some of this issue. And then from Consumer Voice's perspective, we can continue when we have these calls with them to, be pushing this issue and encouraging CMS and the regional offices, because we talk with them as well, to be again reaching out to you all and to the state licensing agencies so that, we're trying to come at it from both sides.
So, Lori, just one thing I want to mention about CMS regional offices, certainly at ACL, we'd be happy to facilitate that. We recently, at the initiation of the CMS regional director in Region 4, we did have a meeting just on this topic with state ombudsman, and she invited state survey directors, and I think it was a pretty fruitful conversation, maybe just a beginning. And in some regions, we have some of the ombudsman regional calls, we can always invite CMS to those calls, or we could again have a different meeting. When we have the Region 3 and 4 call with the Ombudsman program, we typically have both CMS Region 3 and 4 representative from Regions 3 and 4 on that call for at least part of it. So I'd say we haven't been consistent either, but some of it also is up to what the Ombudsman have requested at their quarterly meetings with ACL. So a couple of them have said they didn't want CMS at the meetings. So, but we're happy to try to facilitate that. So, you can always let me know and I'll loop in our state liaison or regional administrator to see what we can do.
Thanks, Liz. I mean, I think that would be great. I mean, I think, the more we can be pushing the regional offices and the state agencies around understanding they have their own challenges, but the more we might be able to, kind of put some pressure points to have conversations with them about these issues and at least all get on the same page with them, we might really see some movement forward the way the Pennsylvania folks were saying. If they would get on board, it might, cut the problems in half. So that might just be helpful.
Yeah, and I would also, again, kind of emphasize that there's also the provider associations that are really important to reach out to, and any corporations that you have concerns about, are additional offers. So, or additional options. It's not only one thing, as you know, it's multiple approaches. Yeah.
This is Eric. I'm sorry, I joined a little bit late. Eric Carlson. For this conversation with CMS, it seems like it might be helpful to come up with a particular ask as opposed to something more specific than just we need to talk about this. But if we can, from this call, perhaps figure out what the biggest problem is and say, this is the problem. What are you going to do about it, or can you do something about it? It might be useful. It sounds like from this call we can maybe come up with a couple of things which would be top of the list.
Definitely. Thank you, Eric. Thanks for joining today. So, any other comments, questions, things you want to share? It can be related to what we were just talking about, or anything on the issue of receiving and responding notices, the discharge notices. Okay, I'm going to take that as a note. Jamie, was there anything else you wanted to touch on before I move on? I don't want to.
Nope, I'm good.
Okay, great. All right. So I wanted to highlight, as I mentioned, some resources and let you know of one new one and where you'll be able to find all the great materials that Jamie reviewed. So just as a reminder, we have a transfer discharge issue page. This is on the public side of the website. So obviously available to anyone and everyone. And it has a lot of NORC resources as well as consumer voice information from CMS, and additional items to share with consumers on this topic. And on the private side of the website, and Katie, thanks Katie, added these nice icons on every single page of the private side of the website. So just to remind you that that's where you are whenever you're looking for resources. So there is a page specifically for program management regarding nursing facility transfer discharge notices. So these have several state examples of what we've received, which includes letters to providers about how to send the notices to their office. It includes some tracking information, including some Excel forms. Ohio is one of the most recent ones we added, and we included Louisiana's flow chart that, and Rosa was kind enough to send the Word version of it too, so that way if you wanted to adapt it to make it state specific, you could certainly borrow that. So that's the whole idea, as you know, behind having a lot of information on the state ombudsman side specifically for you to review, get some ideas, and borrow from your colleagues. So this is the new page that was added specific to this project. It has not been populated yet with the actual materials that we reviewed today, but it will be soon. So this is on the private side of the website as well, because we didn't feel like the public side needed all the state-specific program management materials. However, further along in the project, there will be a page on the public side where the large webinars that are open to everyone, the project webinar, as well as the large webinar that we have for all ombudsman programs and legal assistance providers in September, I believe. That will be where that recording and materials end up, as well as our final resource for the project. But for now, we have this page on the private side, and what we're going to do is include the project state examples, like the materials that you just saw, and it's going to be sorted based on whatever the area focus is. So, except with one exception, just to let you know, the receiving and responding to transfer and discharge notices, this bullet right here, when you click on that, it will say click here to see the state examples, and it'll take you back to this page, because we did not see the point in copying all the information from this page and making this page just really, really long. So we will start populating that page, so just keep this URL with you, because this is what you will be referring back to see those examples from your peers. And as a reminder, we have a lot of consumer education materials already that you can share with residents, their family members, other advocates, and even your ombudsman program representatives. So there's a Prezi that has a video with a voiceover, as well as the clickable Prezi that someone could work through at their own pace and read along with a script, and a PowerPoint that can be used for training, whether you're working with resident or family councils, or even adapting it to make it work with your program representative. And then this fact sheet right here to share with consumers. We tried to break it down and make it really, really consumer friendly. And then we also have on the on-demand Moodle Rooms classroom, we have a course on nursing home discharges as well. So this one, just so you know, is specifically for consumers, and that was the angle for that training and our primary target. So eventually we hope that there'll be one specifically for ombudsman programs, but we're not there yet. So those are some materials for you to use and borrow. And some friendly reminders thank you. Mark, I did giggle a little bit when you mentioned not remembering that you sent us those reports. Thank you for sending us that data. That was very helpful.
What happened?
I think.
Are we here?
Passed out sometime. So that
I'm still here in Oklahoma.
I think we're all still here.
It sounds like we lost Amity, so I wonder if her internet went down. But certainly, so this is Lori. I'm sure that the plan was to send you all the slides afterwards, and so we'll do that. But if she's not able to get in, one of the things that I would just say is back to Eric's point about issues for CMS. I think we are coming to the end of the time for this particular call here, but if you have thoughts about, I guess, particular discussion points around that you would like to talk to from CMS, or particular challenge areas in terms of working with your licensing agencies or CMS, maybe could you send those to Jamie, and we could start working up maybe some kind of issue points or discussion points that we could share, that we all might be having some consistent conversations. And we'll think those through as well. So I see Amity logged back in. And I think you're muted, Amity. Can you, if you can hear us?
Yes. Hello, I'm back.
You're back.
Technology is so much fun.
Just in time.
About that, and thanks for jumping in, Lori. So just wanted to, I'm not sure where I cut off. I think it was around the consumer education materials. So some friendly reminders, like I said, just continue to share your program policies and procedures if you haven't already. Any training you develop. I know that Bill in Oklahoma is working on a consumer education piece, finalizing that. So we are happy to share that with you all once that's done. So thank you, Bill. And just remember to prepare for and join the monthly technical assistance calls. I really feel like these continue to improve as time goes on, and I really appreciate you joining those calls ready with questions and things to talk about and share. So we're happy to provide that space and time for you all. And for technical assistance and questions, please contact Jamie now that she's on as a consultant on this project, and her email is on your screen. So reach out to her first, and then she'll figure out who needs to help with that TA, whether it's something we can address, or CV, or even NICLR.
And I wanted to add, thank you, Amity. I wanted to add too, if you all are trying to figure out how to write, you know, what to put in your letter, if you're thinking about writing a letter to the facilities, or coming up with some tracking, or if you know what you want to do but you're not sure how to do it, just feel free to reach out and I can help you brainstorm.
Absolutely. Thank you so much for adding that, Jamie. So don't hesitate to reach out. Like I said, any questions you want to ask, there's no bad questions here, and it's a friendly group. So we're happy to work with you. We're grateful to ACL for this opportunity with this supplemental grant. And that's all I have for you today. Thank you all so much.
Thank you. Thank you.
Thank you.
Bye. Take care. Bye.
This off the